Hello everyone, welcome to our Nursing Concept channel. In today's video, we will learn about the endotracheal tube, its parts, and their function in a simple and easy way. So, what is endotracheal tube? Endotracheal tube is also known as ET tube. It is made up of flexible plastic tube inserted into the trachea to maintain a patent airway and to provide oxygen or mechanical ventilation to the patient. So now we will start with the first part of the endotracheal tube, that is the tube of the body. So the tube of the body is the main hollow portion of the endotracheal tube. It allows oxygenation and anesthetic gases to pass directly to the lungs. The next part is the bevel. The bevel is the slant tip at the distal end of the tube. It helps in easy insertion through the vocal cords during the intubation. So the next part of the endotracheal tube is the bevel. The bevel is the slanted tip at the distal end of the tube. You can see this is a bevel tip and the other one is the straight tip. The bevel tip help in the easy insertion through the vocal cord during intubation. Next is the Murphy's eye. Murphy's eye, as you can see, there is a small side hole near the tip of the tube. It will allow air entry if the main opening becomes blocked. Next is the cuff. The cuff is an inflatable balloon present near the distal end of the tube. As you can see, the blue portion is the cuff. One is inflated and the other one is deflated. It prevents air leakage and aspiration of secretion. So the normal cuff pressure is 20 to 30 centimeter of H2O. Okay, it is not measured in mm of Hg. It is measured in centimeter of H2O. Now the fifth part of endotracheal tube is the pilot balloon. The pilot balloon indicates whether the cuff is inflated or deflated. This balloon type image is the pilot balloon. It is used to check cuff pressure and patient safety, and also it prevents from accidental extubation of the patient. The next part is the connector. The connector is present at the proximal end of the tube. It connects the endotracheal tube to the ventilator or the oxygen source. For nurses, knowledge of endotracheal tube part is very important for airway management, monitoring and prevent the complication. This brings us to the end of today's video on endotracheal tube parts. If you find this video helpful, do like, share, subscribe to our channel for more nursing concepts. Thank you.